Okay, let's talk about the drug that is literally everywhere right now. It's all over the news, all over social media. But beyond all that noise, what's the actual science that makes it work so well? Let's get into it.
So, you've definitely heard the names, right? Ozempic, Wegovy. They've basically become household names. But what is the actual drug behind them? What's the molecule that's completely rewriting the rule book for how we treat diabetes and manage weight? Well, the name you're looking for is semaglutide. And to really get a handle on this, the first thing we need to do is understand exactly what it is. At its heart, semaglutide is a brilliant piece of mimicry. You see, it's a synthetic, lab-made version of a hormone our own bodies produce called GLP-1. Whenever you eat a meal, your gut releases this GLP-1 to do a couple of things: help control your blood sugar and send a signal to your brain that you're full. Semaglutide does that exact same job, but with one massive upgrade. And this is where the real genius comes in. The natural GLP-1 your body makes, it only sticks around for a couple of minutes before it's gone. But semaglutide has been engineered to be way more durable. It's designed to last, which is what makes a simple once-a-week or even daily dose possible. So it's not some foreign invader, it's more like a superpowered version of something your body already knows how to do. Okay, so how does this supercharged hormone mimic actually pull all this off? Well, it's not just one single thing. It's actually a beautifully coordinated effort. I like to think of it as a four-part harmony happening inside your body. The power of semaglutide really boils down to these four key actions. It boosts insulin, it suppresses sugar, it slows down your digestion, and it curbs your appetite. So let's dive into each of these four actions one by one. All right, first up, it gives your pancreas a really smart signal. It tells it, hey, release some insulin. But, and this is absolutely crucial, it only does this when your blood sugar is high, like right after you've eaten. This is what's called a glucose-dependent action, and it's a huge deal because it seriously lowers the risk of your blood sugar crashing, which can be really dangerous. Okay, number two, it has a little chat with your liver. It basically tells your liver to just chill out and stop dumping so much of its stored sugar into your bloodstream. This helps keep your overall blood sugar levels much more stable and prevents them from spiking too high. Now, the third part happens in your stomach, and honestly, this is a huge reason why people feel less hungry. Semaglutide slows down how quickly food leaves your stomach. Just imagine a traffic controller on a busy highway, slowing everything down. The result, you feel full way sooner and stay full for a lot longer. And that brings us to number four, the grand finale and a huge piece of the weight management puzzle. Semaglutide actually gets into your brain and talks directly to the part that controls hunger, the hypothalamus. It turns down the volume on your hunger signals and cranks up the feeling of being full and satisfied. It can even make those intense food cravings fade away. Okay, so that's the science behind how it works. But let's be real, you're probably hearing a bunch of different brand names thrown around. Ozempic, Wegovy, Rybelsus. What's the deal? Are they different? Let's clear that up. Here's the simple answer. They're all the exact same drug, semaglutide. The difference is just how they're packaged and what they're approved for. Ozempic is a weekly shot for type 2 diabetes. Wegovy is also a weekly shot, but it's specifically for weight management and goes up to a higher dose. And then you have Rybelsus, which is a real game changer because it's the first and only one that comes as a daily pill, also for type 2 diabetes. But of course, with a medication this powerful, it's not all smooth sailing. We absolutely have to talk about the risks and the side effects. This is the stuff you really need to know. Okay, so the most common things people report are mostly, well, gut-related. We're talking nausea, sometimes vomiting, diarrhea, constipation, that kind of thing. For a lot of people, this stuff is at its worst right when they start or when they up their dose. But the good news is it often gets better as their body gets used to it. But, and this is really important, we need to look past those more common issues. There are some very serious warnings that you and your doctor have to be aware of and take very, very seriously. Semaglutide has what's called a black box warning. That's the FDA's most serious type of warning. It's there because in studies with animals, the drug was linked to a risk of certain thyroid tumors. Now, this hasn't been confirmed in people, but to be safe, the drug is what we call contraindicated, which just means you should absolutely not take it if you or anyone in your family has a history of certain rare thyroid cancers. And on top of that, there are other serious, though less common risks to know about. Things like pancreatitis, which is a really painful inflammation of the pancreas, gallbladder problems like gallstones, and even potential issues for people who already have eye problems from diabetes. There's also a risk of kidney injury, which can happen if you get severely dehydrated from all the nausea or diarrhea. So, when you put it all together, the powerful way it works and the very real risks, how should we really think about this drug? What's the big picture here? I think the biggest mistake people make is seeing this as some kind of short-term magic bullet fix. The reality, it's a long-term tool for managing a chronic disease, whether that disease is type 2 diabetes or obesity. It's meant to work with diet and exercise and a real commitment to your health, not replace them. And this right here is probably one of the most important things to understand. The drug works because it's actively managing your body's chemistry. So what happens if you stop taking it? Well, those systems go right back to how they were before. Study after study shows that when people stop the medication, they usually regain a big chunk of the weight they lost. That just proves that this is a tool for long-term management, not a cure. And look, beyond all the science and the medical stuff, the real-world challenges right now are huge. These drugs are incredibly expensive, and getting insurance to cover them can be a nightmare. All that demand has also created massive shortages, which is a real problem for the people with diabetes who depend on this stuff to stay healthy. So there's absolutely no doubt about it, semaglutide is a total game changer in medicine. But its arrival leaves us with this massive looming question that we all have to wrestle with. As a society, how do we handle the cost? How do we make sure people who need it can get it? And what is the long-term role of a medication like this in the future of public health? That's the really big conversation we need to start having now.